Hi, I'm Owen Canfield with the opinion page of the Oklahoman, joined today by Mike McNutt, our Capitol correspondent, and by the Speaker Designate of the State Legislature, Representative Chris Steele of Shawnee. Chris, thank you for joining us here today at the Capitol.
Thank you for the opportunity.
Well, we get together every week to talk about the week that was in the legislature. It seems to me that one of the items, of course, is going to be the budget every week. The governor's money man, Scott Meacham, said this week, he hinted that there could be even perhaps a veto of the budget bill reached in for fiscal 2010 if things didn't get straightened out. Is there any concern among the leadership that may actually come to pass?
I sure hope not. We feel confident that the budget negotiations process is going well, and that the 2010 budget, or the 2010 budget,
right,
needs to be taken care of sooner rather than later, so that we can begin work on the 2011 budget. And we're optimistic that we're going to be able to reach an agreement and see this through to the finish line without a veto.
Right.
There is some talk, though, that Representative Miller, your chairman, House Budget Committee chairman, would like next week to start putting through some of these appropriation bills for the fiscal year 2010 budget. Is that still online?
As far as I know, it is. As far as I know, that is the goal, and we're on track to do that.
What are some other issues you hope to really work on hard this session? You sent out a news release yesterday, I think it was yesterday, Thursday, about some of your healthy lifestyle initiatives that you'd like to see done sort of on a voluntary basis around the state. Can you talk to us just briefly about some of those ideas?
Yes, I can, and I appreciate the opportunity. Truly, in Oklahoma, we struggle with some major health outcomes, particularly in the area of heart disease, stroke, diabetes,
right,
obesity, COPD, which is a chronic breathing condition. And most of those conditions can be preventable and can be traced back to poor health decisions. And so what we want to try to do is not mandate, but encourage and
right,
incentivize healthier decisions, healthier lifestyles. And the way that we're going to do that is to try to provide an incentive for local communities to come together and really raise the standard of living as it
right,
pertains to healthy options at the grassroots level and also in our schools. And we're very optimistic that we may have an opportunity to work with chambers of commerces,
right,
and local communities to accomplish that goal.
So the thought is get it started in schools, get them started when they're young, thinking healthy, talking healthy, living healthy, and over time reduce the health care costs that are such a burden on our budget right now.
That's exactly right. These five major categories that we just identified, right, really affect the state from an overall health standpoint as well as a budget standpoint, because the treatment for these conditions are very expensive, and it truly causes everybody else's health insurance to rise.
Right.
And so we want to try to prevent that and reverse that trend.
Sure.
And you've got a couple other priorities you want to try to get accomplished this year. Workers' comp and education.
Workers' comp reform and education reform, particularly in the area of education reform. We feel like there's an opportunity to really implement a performance pay plan for teachers who are going above and beyond to really educate and provide a tremendous educational opportunity and experience for our children. I understand that the governor is also very open to that idea and is supportive of the idea, and so we think that we can begin to introduce some incentives and reward those teachers that are really getting the job done, and we're excited about that. It's an issue that we've been working on for a number of years, and we think it may become a reality this year. And also in the area of workers' compensation reform, we think it's very important that we identify ways that we can lower costs for businesses and maintain the services and the treatment that injured workers have, and so that they can receive those services in a timely manner and return to the job as soon as possible, healthy, strong, and ready to go.
What else is on your mind today, Mike? Well, end of another long week for you out here every day at the Capitol.
Yes, absolutely. And we had a little bit of discussion on the budget, and one of your members brought up the alternative budget,
yes,
which was discussed for an hour or so. Eventually, we slowed it down because it wasn't balanced, and certain amendments were filed to it. A lot of discussion about the budget process, whether it's open or not. Representative Miller, your budget chairman, said this is the way it's done in all the other states and in Congress. Is there any way to improve how the state develops its budget, or is this as good as it gets?
Well, that's an issue that we constantly are talking about and revisiting, and we want to make sure that our process is as open as possible. We want to make sure that our process is as transparent as possible, but we also realize that we have timelines and obligations that we have to meet in order to complete our work, and so it's always a balance. And I really do think that there is significant participation and a tremendous amount of openness and transparency within the subcommittee budget meetings and our committee members do a tremendous amount of work and do a really good job in really weighing through and working through those issues.
And people can come to these subcommittee appropriations meetings directly open to the public, and where can they find? They're listed on your website, correct?
They are. They can go to the homepage and look for agendas and of calendars and what have you, and it's all posted right there and accessible and available to the public.
Representative Bench, thank you for your time. Great to have you here today. Good luck to you as Speaker a session from now. Mike, thank you for your time. We ask you to continue reading each day in the Oklahoman coverage of what's going on at the Capitol and see it here on News OK.